But I mean, so much of this is, it's also, the medical technology has allowed for us to have patients that are born younger with more medical conditions that are sicker when they're at various stages of their life that allow them to carry on. And from that standpoint, with that comes, the complexity along with that. And so from that standpoint, it's something where I wouldn't want kids to necessarily become less complex just in terms of our general society or other things along those lines, because I think what we're seeing is some of the beauty of those initial surgeons that perform that life-saving procedure at day of life 1, and that, all that comes from that afterwards, we're there to help out with everything else. So from that standpoint, I think that this population is growing because of all the wonderful things that we're able to do for some of these children very early on. And so from that standpoint, once we get to that point, then it becomes a matter of how can we prevent issues, because in pediatrics in particular, prevention is such a more efficient way of going about medical care, as opposed to, slapping a Band-Aid on everything that happens and then coming back to it again over and over again. So from that standpoint, we really strive for that. But it's a problem, but a good problem, at least in terms of some of the medical complexity that we see.